Everyone, my name is Ricky Leung. I am Associate Professor of Public Health at the University at Albany, SUNY. I just want to produce a series of videos, teaching videos, information videos about the coronavirus. This coronavirus originated in Wuhan, China, and there's a lot of new information and scientific findings that we can find every day. I think this is useful for those who are interested to take a look at this information. And I'm just here to try to provide some, if you like, layman understanding about these findings. I think it's useful. I also want to share this with my students in the global health course because I think this is so relevant to them. It wasn't planned in the syllabus because I totally didn't know that this will happen, and it happens so rapidly. But I think it is very useful. So let me show you this. The papers that I chose to report and to summarize here, most of them are from more high impact journals in the medical field or public health. For example, this one is from the Journal of American Medical Association, or sometimes we call it JAMA. It is reported by a group of researchers from Wuhan, China. And I believe the staff of JAMA probably also work really diligently to with this group of researchers to allow them to report the findings so rapidly. But anyway, let me highlight this paper to you. I like to do it in no more than 15 minutes about that, and so that you will have the enough attention span to go through the highlights of the paper. So the disease was believed to emerge around December 2019. So sometimes it's also called the 2019 novel coronavirus. It's also abbreviated as the NCIP, novel coronavirus infected pneumonia, because a lot of these symptoms for patients who were diagnosed with the virus has a lot of symptoms in other pneumonia patients. So NCIP, okay, and the authors of this paper reported that as of January 31st, 2020, there were a total of 9,692 cases. I believe if you look at the World Health Organization website, they have daily update. As of the latest update that I've seen, it's more than 44,000 confirmed cases. So it is really rising so rapidly. And the first cases they were reported in another paper in another influential journal called The Lancet, and it was believed that all these 41 first cases, these first patients had a history of exposure to the Huanan seafood wholesale market, and so this is also believed to be where the disease originated. So for this paper, this particular paper that we're seeing now on the screen, it was about this 138 patients enrolled to the Zhongnan Hospital of Wuhan between this time period, January 1st and January 28, 2020. And obviously the number will be much higher if we include a later time endpoint. And so of these patients, the researchers were able to collect various types of information, medical records, laboratory findings, and so on from different equipments. And electronic medical records, for example, probably provide a lot of useful information. The particular test that the medical staff in this hospital use to determine whether a patient has caught the disease is through the throat swab sample. This throat swab sample is a very commonly used procedure in hospital, even in clinic. Basically, the doctor or the staff will put something like a cotton bar or something, and try to get a sample from the throat of the patient, and then the sample will be analyzed using RNA techniques. Try to understand the genetic sequence of the sample, and if the genetics, the target of the genes, this ACTG, this all this gene coding match a certain pattern sequence found to indicate the disease, then the patient will be diagnosed accordingly. And they use something called a CT or a cycle threshold value between 37 and 40. I think anything lower than 37 is defined as positive, higher than 40 is then will be safe. Anything between 37 and 40 will be suspected. So that is like how patients will be diagnosed. And then among these NCIP cases, the researchers wanted to know some of their demographic characteristics, as well as their underlying comorbidities and other information. Based on this highlighted section here, you can see that the median age of the patients was 50 years old, and there were slightly more men than women. 75 of them were men, and the rest were women. You can actually scroll up back to find the information more clearly from table 1. And another information is whether the patients will be admitted to the ICU, the intensive care unit, or not. So the majority were not. 102 were admitted to isolation wards, that means non-ICUs, and the rest, I believe 36 of them, were admitted to the ICUs. And the researchers also compare characteristics between ICU and non-ICU patients. These are the images from the CT scan for patients after 5 days and 19 days. Basically the symptoms progresses after this 14-day period, and the most common symptoms at the onset of the illness include fever, fatigue, dry cough, myalgia, and also dyspnea. Other commons include headache, dizziness, abdominal pain, diarrhea, nausea, and vomiting. So basically, people who feel tired, sick, cannot breathe very well, and so on. Those are kind of like the symptoms. And the other patients, the patients again, they will compare the characteristics for patients between the ICU and non-ICU patients. They saw that the underlying comorbidities that they want to compare include hypertension, diabetes, cardiovascular diseases, cerebral vascular disease, and so on. So those were some of the more significant difference between the two kinds of patients. For other vital signs like heart rate, respiratory rate, and arterial pressures, and so on, they did not differ significantly between ICU and non-ICU patients. Now, the patients show organ dysfunctions, and these organ dysfunctions, by the way, we believe to be the real like the immediate cause for patients who cannot survive, and they also have tried different treatment. Antiviral therapy and antibacterial therapy have been tried, and other similar kinds of therapy have tried. Unfortunately, not very useful. Most of them are not useful, not effective to cure the disease. And you can also actually see from this section here, I didn't highlight that, but around here, as of February 3rd, 2020, 85 patients were still hospitalized with among this 138. 47 patients were discharged, they went home, and 6 patients actually died. Okay, but it's not clear how many of these patients were in the ICU and in the non-ICU, but a total of 6 patients died among this 138. There's another concern about whether patients actually caught the disease within the hospitals. And it was presumed that 57 patients were actually infected within the hospitals, including 17 patients who were already there for other reasons, and also 40 medical staff. Now, based on this report, I mean, there's clearly some important clinical characteristics that progress differently between the non-survivors and survivors, and again, organ dysfunctions, and also the loss of the immunization ability, the ability to fight the diseases, probably explain why some of these patients could not survive at the end. Now, this show that there were very rapid person-to-person transmission, and some of the tests were still not even useful. But I mean, it's very clear. Actually, also based on one of these R0 indicator here, it means that on average, each patient can spread to 2.2 other people, right? According to this research here. Some of the tests, like the stool samples, were not very reliable at this time, and so we don't know about those. We know that older patients tend to be in high risk because they usually have more comorbidity risks, like they already have like hypertension and other heart diseases and so on already, and so the weaker patients to start with, and this increased the risk for them. There were no significant difference between men and women based on this sample. Again, we saw these different clinical indicators about why some patients could not survive, and those are more deeper medical reasons about and about why the non-surviving patients finally die, and you can take a look and do more research to find out that. But the final point about this paper is that until now, because there's no specific treatment that can fight this coronavirus infection, this disease, and also because it was so contagious, the best approach is to control the source of infection, use of personal protection precaution to reduce the risk of transmission, early diagnosis, isolation, and other supportive treatments. Those are important for patients. Again, there were no effective treatment as of now. Antibacterial, antiviral, those agents haven't been proved to be useful for treating the disease. So the best approach so far is just to prevent the disease from spreading to more people. So I'm going to end here. In different videos, I'm going to talk about other information such as the World Health Organization report, and maybe other things related to protection